So the last video that we talked about was self-help, things that you can do on your own in order to help recover from post-COVID syndrome or other acquired brain injuries. This video is more about professional help, things you should reach out to somebody who is well trained for guidance and assistance to do. So first talking about nutrition. Nutrition is so important to do. It's not just eating the right foods and not eating the bad foods. Sometimes you need to supplement your body with appropriate foods or appropriate nutrients based off of what your body needs. You can go and see a nutritionist if you have any sort of, or for the next step up, if you have any sort of comorbidity or diabetes or thyroid. You can see a dietitian because they're going to help tailor your diet to what is appropriate for what conditions you already have, and then you can also tailor it to what you may need in addition. You can also work with a functional nutritionist who's going to may use some blood labs to figure out, based on your body chemistry, what nutrients are you missing. You can also go the next step up to functional medicine practitioners who are going to use a functional medicine approach specific to your symptoms and, more importantly, to the processes causing those symptoms. For those who don't know, functional medicine is a system-centric approach that should blend a physical examination from a trained physician with the functional medicine approach of figuring out which systems in your body isn't working appropriately and what to do about the causes of those systems. For that, I would recommend seeking out a functional medicine doctor, or at least seek out a functional nutrition specialist who can work collaboratively with your primary care doctor. That being said, if you have neurological symptoms, like a lot of the stuff that's happening with post-COVID syndrome, I recommend looking for a functional neurologist. My office is a functional neurology office. We use a functional medicine approach combined with a functional neurological approach to provide an in-depth look at the brain and how nutritional strategies can create resolution for the symptoms that you're having on an individual basis. For example, a lot of patients that we get coming in with post-COVID have fatigue, brain fog, and focus. And brain targeting anti-inflammatory support seems to be really helpful. So my starter protocol for most non-complicated patients means that I give them 2 products from Apex Energetics, Neuroflam, 3 capsules twice a day, and nitric balance, either 5 to 15 milliliters, depending on what the patient is dealing with in the morning. That being said, this is not what we use every time for every patient because every patient is different. We need to do an exam. We need to figure out what's going on with the individual person. And from then, we may switch some stuff up. From a nutritional perspective, we may use a product from a company called Zymogen as well, or we may switch things depending on allergies or depending on what we're finding in the exam that the patient really needs to improve. After a nutritional perspective, you can also use a rehabilitative approach. A rehabilitative approach is important because, think about it from this perspective. A rehabilitative approach is needed because in your brain, you have neurons that connect to each other. And the problem is, for every 2 neurons that connect, there's always an immune cell that helps modulate it or control the output of that first cell. If your immune cells are now firing too high for too long, that's going to change the way your neurons can communicate. And over time, certain pathways are going to get smaller and need to be exercised. Or from the actual initial trauma, if it was a regular concussion, those pathways themselves might be injured. So the first thing that you need to do is you need to understand that rehabilitation of those pathways and exercising those pathways using neuroplasticity allows patients to recover, not just make compensations for what the brain thinks is going on. So the first thing that you need to do is look at the symptoms that you got. And target those symptoms. So if you have a sore throat, fever, rash, cough, shortness of breath, go to your primary care physician. Get checked out. Make sure there's nothing worse going on. If everything is fine, then move on. So if you have myalgia and chronic pain or any musculoskeletal, like sore muscles, joint pain, stuff like that, movement issues, physical rehabilitation may be the best way to do it. My recommendation that I give my patients is seek out a physical therapist or a chiropractor that is well trained in the functional movement approach. Uh, and because the idea is that inappropriate or reduced motion causes pain. Improving and creating more appropriate motion reduces pain and prevents relapse. So passive therapies that just reduce the pain is not necessarily fixing the problem, it's just helping you get through the day. But the idea is you should be doing things on your own, like stretching and strengthening techniques that help your body move better. For any anxiety or changes in mood, go to a mental health practitioner. They are well trained in handling those. In addition, if you need any help with mood changes, memory, sleep, focus, or cognition within the context of a daily routine or work or self care, going to an occupational therapist would be great as well. Now, instead of targeting the symptoms, if we want to target the causes of what's going on and the areas of inflammatory changes, and this is what we do in our office at Delta S Performance, we want to focus more on the changes in mood or cognitive function and say, well, if it's not purely mental, could there be a physical process that's causing it or making it more difficult for your brain to cope with the world and the challenges that's receiving? So we'll look most commonly into anemias and thyroid autoimmunity, but there's a bunch of other things to look for on laboratory analysis. Movement processing is also really important. So since this is some shades of gray of a brain injury, using a graded return to play or return to work protocol that's listed right on the SCAT5 actually is really helpful for recovering from post-COVID syndrome. And my recommendation is working with a chiropractor, physical therapist, or athletic trainer who is trained in the return to play or return to work program would be the best bet to do for that when we do that at our office as well. The other thing that we do, and this is our bread and butter of the office, is that rehabilitative model. Because remember we were talking about when we drew it out in that earlier video that a lot of the damage and a lot of the inflammation happens in brain tissue, specifically in that lower brainstem. That's where a lot of information comes in. A lot of information from your eyes and a lot of information from your inner ear, which allows you to figure out where you are in relation to gravity, connects in that brainstem area. And so we use in our office vestibular and visual rehabilitation for improving that neurological function that can be affected by that chronic inflammatory response that COVID-19 causes. In short, using this form of rehab can help rebuild and reconnect those neurons that were damaged during that initial inflammatory onslaught from COVID-19. So in our office, and a lot of symptoms that we see people having who are long haulers we'll do some rehabilitation for dysautonomia or changes in their sympathetic and parasympathetic balance. Patients like these will also sometimes have POTS. We see these often in our office, and we've seen some good results with them as well. Eye movement mapping and correction of errors in that eye movement, and VOR, so vestibulo-ocular reflex between your inner ear and your eyes, and fine-tuning of reflexes that control equilibrium, balance, mood, and cognition can be done using a rehabilitative model. And then also balance exercises and rehabilitation for the cerebellum can help with a lot of the movement and musculoskeletal complaints that people have. So these are just a bunch of approaches that you can have if you're dealing with long COVID that you have the next step to do. Try one, if that doesn't work, move on to the next step and see what else can be helpful. If you have any questions, always reach out to my office. You can call my website and do an information request, and I'd be happy to answer any questions that anybody has.